covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We certainly appreciate you spending part of your day with us. And quite honestly, I cannot believe the time has rolled around once again for us to air this, our giving edition of the Means Report. We do this every November for Thanksgiving, and it's a chance to spotlight 3 nonprofit agencies in the CSRA that need your help, especially as you consider your year-end giving. We want to call attention to these fine folks and let you know what they do and how you can help support them. We have Christ Community Health Services here on the Means Report today, Augusta Rescue Mission here to tell us what they do, and the great work at the training shop will be in the spotlight as well. Also, we'll always wrap up the Means Report with ways that you can stay in touch with us. It is easy to do that, and we will show you at the end of this broadcast. But first, let's get to Christ Community Health Services and Ron Skeens. He's the Director of Communications and Development. And Ron, thanks for coming back to the Means Report. I was telling our other guests, you're the veteran here. I'm glad you're back.
Thank you for having us, Brad. I appreciate it, really do.
Me too. And it'll be a busy show today getting to all 3 of you all. So let's just jump right into what Christ Community Health Services does. My recollection from our last conversation is that y'all provide medical care for those without insurance.
That's correct.
How do they prove that, and how's that criteria work when somebody walks in?
Sure. Well, it's helpful for folks to know that beyond neighbors in the community who don't have insurance, we also welcome folks who have Medicare, Medicaid, and even some of our patients have full-on commercial insurance. But the largest slice of our patient pie is those neighbors in our community who do not have insurance. And despite the incredible medical resources we have in this community, if you don't have that insurance, it can be really tricky to get the dental care that you need. And that's where Christ Community Health comes in. We are providing those neighbors, those families, the affordable medical and dental and integrated behavioral health care that they need, even if they don't have insurance. Regardless of income, regardless of insurance status, we become their primary care home.
You know, that's good information for those of us to remember who are going through open enrollment right now and perhaps complaining that it's tedious and time consuming. Think about those who don't have insurance whatsoever.
Exactly.
What's the main reason they come in? Is it because I have a runny nose, maybe a broken bone? Why do they walk through your door?
The same reason anybody goes to their primary care physician. It could be a cold, it could be something more chronic than that. But think of us like your primary care physician, Brad. We're providing the same services, the same care, the same compassion to these folks. They just don't have the insurance that might get them into another practice in town. So they come into our doors for just a regular annual checkup, a biannual checkup. It could be something more complex than that, but we're just primary medical and dental care like any other practice in the Augusta community.
Well, the local emergency departments have to love y'all. Don't you take a burden off of them?
We do. Someone who may be thinking, well, I've got a sore throat, let me go to the ER. You know, that's not really the kind of situation that requires a trip to the emergency department. So we're here to take the burdens off the ER, keep patients healthy, keep them working, keep students focused in school so that they can get the grades they need to advance on to the next grade. Families, moms and dads can stay at work, bring in the income to support their families, and be participating, thriving members of our community.
Talk to me about the growth that you all have enjoyed, and we need the community to help that growth to continue. The first time we talked, you were at, and I believe it is the original location of University Hospital. What's happened since then? Well,
we're 16 years old now. When we started, we were in one building on Datanack Street, right across from University, now Piedmont Hospital. We now have 4 different locations. One next door to the original location, which is a dedicated children's clinic that we opened in January of this year.
Big.
Our dental clinic is actually in the old Widow's Home building in Old Town. So we've got a medical clinic on the first floor of that building, dental clinic on the 3rd floor. And then 3 years ago now, we opened what is now our 4th location in South Augusta off Peach Orchard Road. So we cover the entire community. We actually see patients from about 10 counties around Augusta. So we have grown a lot. 125 people on staff now, all dedicated to providing that medical, dental, integrated behavioral health care that so many families in our community need.
How's the children's clinic going? Are people taking advantage of it?
Absolutely. It is booming. We added another full-time pediatrician to our team 3 months ago now. So that has just been a real blessing to the families in our community who are, the moms a lot of times are more comfortable with a dedicated children's clinic they can bring their children into. And so we're happy to be able to provide that now.
I recently read about an effort in Memphis to provide funding from Congress for the Christ Community Health Services locations there. My question to you is, where do you get your funding? Because with all those doctors and nurses and staff, it takes a lot, I would imagine.
It does. Our operating budget has grown significantly as we have grown. We're what's called a federally qualified health center. So we do get some federal funding.
Yeah.
We get support from Piedmont Hospital. We get support from all sorts of local charities, the Community Foundation, for example. We get support from them, local charities, and we're not a free clinic. Everyone pays something. If you don't have insurance, this is an important thing to note, what you pay is based on your income. So it may be $25, $35 if you don't have the insurance. But if you are covered, then we file those claims like any private practice does. And then, getting to the point of our time here today, we rely on donations from members of this community. The money that we get donated helps cover the cost of the services that we're providing versus the discounted fee that we charge someone.
And we do have the website. Jarrett, you probably have already put it on the screen. Forgive me for not noticing, and thank you for doing it there, where folks can log on and donate there, I'm sure.
Yes, absolutely.
And I want them to. Christ is in your name. Do you cater to people's spiritual care?
We try to do that. Our mission is to proclaim Jesus Christ as Lord and demonstrate His love by providing affordable, quality primary health care to the underserved. So that's in the warp and woof of what we do. We welcome anybody. That mission statement tells you what our motivation is, and it tells you that our arms are open to anyone who walks through our doors. So we try to demonstrate that love. We try to treat everyone who comes in through our doors with respect and dignity and care, and just demonstrate His love through our patients. And the way we work that out is with the medical and the dental care that we provide them.
Probably my last question, and it's just to reiterate the need for community support for Christ Community Health. Are you short on doctors and nurses? Do y'all need to hire more?
We are recruiting other staff members now. You can find that list on our website, but the donations that we get from the community are a critical part of us being able to provide these services. And this is to families, this is to neighbors in our community right here in Augusta and the CSRA. And the support that we get from individuals who are watching this and all across our community helps us continue to meet the needs of these families who are really, this time of year, really looking for an affordable, quality option for their health care other than the ER like we mentioned earlier. So these donations are an amazing blessing to not just to us, but to these families who we're caring for.
Well, it's been an informative 7 or so minutes, Ron. I appreciate you enlightening us as to what y'all do, and I hope everybody will support Christ Community Health. Thank you for what you do.
Thank you, Brad. Appreciate it.
Absolutely. When we come back, we're going to talk about the Augusta Rescue Mission and how you can help it do the great work that it does in our community. And still to come, the Augusta Training Shop. We will hear from those fine folks as well. The giving edition of the Means Report.